after, we would always examine the person, find out range of motion and how far they can go with their neck and turning and different range of motion. In the interest of time, I'm not going to take you through all that. I'm just going to show you some of the techniques. So the first one is, Len, I'm sorry, man, I lay back down on your bed. We decide we're both going to get our exercise in right now. Up and down today. All right.
Yep, we've got plenty movement.
So first one is, and this is good for patients that have pain. Again, for all the reasons I mentioned before, especially cancer-related pain, or just anyone that has, let's say, a stiff neck. Any one of you, if you're reading, studying, have your hands down, or you're looking intently on the screen today in the presenters, you may develop a stiff neck, you may develop some spasm. So these are some common treatments. Anyone, whether you're an MD or DL, anyone can use these treatments. So the first one is using the pads of your fingers, going at the base of the neck, just above the thoracic spine, and you're basically going to have your fingers at the soft tissue, the paraspinal muscles, and we're going to be using some traction, so some soft tissue, and pulling the paraspinal muscles and the soft tissue towards me, right? So it'd just be palpating the area, getting my fingers into a nice groove of the soft tissue, and with some traction, I'm pulling up and then using the traction to pull the muscles and the soft tissue until I feel a release. So I'm going right up towards the occiput. And I do that a few times, okay? And then when I get up to the occiput, I'm gonna do, it's a modified craniosacral treatment that we use. There's something called a CV hold or a CV vault hold. Basically making like a diamond, not diamond, triangle shape with your fingers. And when I get to the occiput, I'll have a patient take some nice, slow, relaxing breaths. It helps actually relax everything from the base of the spine all the way down to the sacrum. From the occiput down to the sacrum. So as I would come up, okay, I then go into this hold, and then I ask, take a breath, nice, slow, relaxing breath in and out. And as I do it, I'm monitoring the occiput and using my fingers. I'm doing some mild soft tissue on the occiput. So a lot of people that have headaches, especially tension headaches or migraine headaches, it's because the muscles that connect back into the occipital area, that's where the most tension is. There's a lot of tension back there, there's less give. And so that combination of soft tissue treatments and the craniosacral is really good for patients that have headaches.